All right, guys, welcome to our second session, which is on our mentorship program in data analysis. And as always, I'm sincere and I'm happy to have you guys. So today we are moving into fine-tuning your research question and really understanding how research questions are to be arranged, especially in systematic reviews. So one thing I'll let you guys know is that this course is an original course, and the way we are building your content, you will not find it anywhere. Um, when you move further in your life, you would appreciate what we are doing here. But for now, just trust me on that. You're going to appreciate it. Now, I'll start first of all by just showing you guys again the curriculum, which is what I think all of us should be looking into it. So, I mean, if you are in doubt anytime, any day, this is your ground truth. You have the link to the classroom, you have the password if it's your first time you're doing it, you have your clear milestones. And what I'm trying to point out here is that we are approaching January 24th for where we want to assess how well you guys are ready with your protocols. So it's very important that you're ready with your protocols, but we are going to see how to adjust that. Because from what I'm looking, we might not achieve that, but it's okay. If you can do it, then it's ideal. And then we have 14th of February, we have 7th of March. So this is uh this is an intensive course, and um all of you doing it. We had discussions about the intensity of the course. Probably you did not think about it this way, but you see that there's much to do. And that just simply means that you have to sleep less and you have to work more on this, or you have to cut down social media time with friends and other things so that you can do what we are doing here. So, in this document, which I believe all of you have the links, again, I'm just reiterating the sessions are numbered. So we started on the 20th of December last year, and you have the slides that we use and everything, and you already have these things. So every link you see here, you can access the documents. And if you're doing it for the first time, you are going to have to request, and I'm going to approve it. So some people come and request at 11 p.m. For access. I mean, I'll only reply to you in the morning because by 11 p.m. I don't, even if I'm awake, I'm not looking at my phone, I'm not looking at other things, I'm doing my own studies and things for me to learn more, learn new things so that I don't come and tell you guys things that are wrong. So do that during working hours, and I'm going to do it immediately. Or do that as soon as you receive the email, even if you're not going to read the document on the day, do it early because whenever you want to look at it, then you will not need to request for access again. So if they say deadline for the quiz is at midnight and you come and request at 11 p.m., there's no guarantee that you're going to get approval before midnight. So that's just an aside. But you see that each column here gives you your objectives for the session, this column, and then the things that you need to do before that session. And this is always populated, and then the things that you need to do after the session. So this is what we are doing. And then you have your things that your access to everything that you need after the session. So this is what we did last week. And this is where we are now. And I mean, during each week, I'll always highlight the week of concern so that when you're opening, you see where we are. So this is where we are now. And this is are the things that I expected that everybody should have access to. Yeah, and what we want to really complete by the end of this session or by the end of this week is that you have an understanding of the first part of your proposal. So you need to be on the neck of your mentors. Now you see that week 3 and the rest weeks have not yet been expanded because I am making this content anew. So I only put it on Wednesday when I update it. So this is what we'll be doing next week. And so you see that there's no link yet there, but by Wednesday I'm going to update that. So that's what I want to bring your attention so that this is your ground truth. And this is where you can always come and look at it and you have information. So that's it. Let's go to your quiz. Lydia, Patrick. Okay, we lost Frank. Hmm, good. So now that you guys are 12, you guys have the opportunity to ask me any question that you want because the class is not crowded. So I'll have attention on you guys. So let me go to my presentation. Um, let me know when you can see my screen, guys. But today's session is really, I mean, it's all hands-on and it's easy stuff for you guys. So I don't doubt that you guys are going to crush it. All right. So we are in session 2, which talks about using the methodology that is suited for you and also using the question that you need. So that's it. So it's basically we're introducing you to the methodology and how to formulate your question. So far I've seen you guys formulating questions in your own way, which is good. But if you read the documents and the links that we shared to you guys, it's going to give you a good insight to that information. This is what I was expecting you guys to all read before or do before the session today. But let's look at the quiz. So this week, I'm happy for only 4 people took the quiz, but the results have improved from what we had last week, and the average course is around 10. So that is very good. But let's look at the questions. I think what's most important here is that our typing is a problem. I don't know if I'm not communicating it well, but if there's anything, what do you guys think was off with the fact that the questions you type the correct answer and then the system did not recognize it? What was off? Anybody can feel free to unmute and let me know so that I know how I'm setting the next set of quizzes because you definitely have to always write something. Anyone? Lydia, Patrick. Yeah.
Okay, for this particular question, initially I felt I wanted my first answer was going to be to combine all empirical. I was like, okay, when I was reading, I did not actually see the word combine. Then I used synthesize, but then when I saw the correction, it was like synthesize. It was not just that word that was needed.
Mm-hmm.
And it's like more was needed there, but I did not really.
All right. I see. I get so I guess I would say I will guide you guys like 2 to 3 words, 4 words, 1 word only. Will that help in the next quiz?
Yes, Doctor, I think it would.
All right, so that you know how much you have to write. Okay. What about you, Patrick? Do you have any comments?
Basically, what you just said was exactly what was in my mind. I think um, the idea is very good now. Well, questions like giving like that, they are you have many combinations possible. So I tried to build this in the this is a PICO, letter, or I think that would be better for us to reduce the number of combinations possible. I think that was good. Yeah. But I think it's a good attempt for questions because it makes us to be more vigilant in answering questions, quickness of the writings and also understanding the questions. I think it's
All right,
important.
thanks, sir.
Yesterday we just had one of such questions. I think if I remember well, it was just one of such questions. I think it will be better for us to you put at least two quotes of question because it's just important.
All right, good. So I should put more questions that you guys write. Okay.
No, they are enough. The questions are enough.
No, I mean it's the same number, right? But I should balance the number of ones that you have to fill in the blank space because I mean there are three formats: fill in the blank space, more than one answer, and one answer.
Yeah,
So that's what I
yeah,
do.
that's right.
So all right.
Okay.
Yeah, no, yeah, we'll keep the questions between maximum 12 or 10. I averagely 10, maximum 12, depending on what we are doing. Okay. Good guys. Nice. So I think it's just to review the questions, but you guys had most of it correct. What is the primary goal of this? To describe the history of the research field. So this was a very good trap and somebody fell for it. So just it, but I mean, three of you had it correct, so it's fine. So yeah, it's not to describe the history, but it's okay. The next question, which frameworks are these used? So these are the things that are useful for systematic reviews, and I'm happy. Again, one person fell for the care guidelines for case reports. So this is what you are using if you're writing a case report, not a systematic review. So again, probably somebody did not read the document that was shared. And last but not the least, yeah, plan research strategy. So not everybody checked this, and then this one too. Mm, was not a very good answer. So um, the question is, which of the following should be specified in a systematic review protocol? And I even got them before, change it so that you know that the before is important. The review starts, you know. You cannot be talking about final conclusions of the review in the when you have not done the research now. So yeah, but it's okay. That's fine. So somebody selected this one, but majority of you had the correct answers. Okay. So again, this will always be in the lecture slides so that everybody understands what we are doing. Before each course, you're going to have a pre-reading and a pre-quiz, and then you're going to have this session, and then you're going to have a task that you receive. Okay, and I mean, towards the end of the course, we'll give awards to those who are always present and those who are always completing tasks and those who are always passing the quizzes. So that's the system that we're doing. So you always have this. That's the model of training. Yeah. Now, where we are, it's systematic reviews, right? And today we'll be talking mainly about systematic review questions, right? Systematic review question and how to start the protocol. So this is where we are focusing today's lecture. This is where we're focusing today's lecture. Yeah. So it's very important that you guys know so how to start the protocol because by next week we should have an idea of what you guys have written as the first part of your protocols, which is very important. So it's very important. So that's what we are doing here. Mhm. And yep. Is there any question on how we are going about this? No, I guess.
No, for now, so
Okay. This guy, let me so clear what I have done. Okay, nice. That I can just reset this thing now. All right. All right. So for today's lesson, what we are going to learn is really identify the features of a systematic review versus other storytelling reviews. Explain why rigorous methods are important and why we need to reduce bias, and then start matching questions to some various common types of question, and then refine what you guys have already started doing, and then describe how we move from protocol and to how we report systematic reviews. So this is what we are going to be doing. Um, as always, we are going to have the short session, which I call this session Inside a Systematic Review. And then we'll have a discussion, um, and review and critique of your questions in lecture in the first session. And then we have a micro workshop. But I mean, if we are not many of us, so would stay here in this room. There's no need to divide us. So that's just what we are going to be doing. That said, the most important thing that I want you guys to pay attention to is that in this session, we really want to help you know how to formulate your question, really define the scope of your question, like what am I going to be looking all through, and understand how this is going to help us build your search terms when we talk about search strategies. So that's what's most important here. And then really clarifying how from a question you can already develop an inclusion criteria, and also how we can take care of bias in our work. So that's what is most important for us in today's session. And then we are going to be able to understand how credible systematic reviews are made um, using all of what we have just discussed. So that's it. Um, so I think it's very clear, but if I was to ask in the group, who here can give me, I mean, it's on your screen, but who here can give me in their own words what the difference between a systematic review and a narrative review is? Who here can give me what it is? I see Joseph. Joseph, welcome. Internet has not been kind on you. And yeah, so anyone wants to take the floor, or else I'll call names. Um, hello. All right, Patrick, go for it. What's the difference between a systematic review and a narrative review?
But as you said, it's just right in our screen. So I don't know if they expect us to be reading what is written
No,
there.
no, no. I mean,
So,
you use your own words to describe what you see on the screen. That's what I'm saying.
okay. Thinking about systematic review, I think the you need to actually establish a protocol so you can go actually undergo and get through a systematic review, which is not necessarily the case for a narrative review. And for systematic review, you have less risk of having bias, which is not the case. The risk or the chance of your research being biased generate exactly to data. And then now I'm talking about the methods. I think you, for actually achieve this connectivity, you have to follow in place certain methodology and different foundations which can permit the others if we have to actually understand how you came about the result. They can just follow the methods and the methodology and actually get us is that which is dependent of the individuals. Then also I was speaking about the transparency of system important
Mm,
an important difference. but
All right,
the
that's cool.
linguistic
That's
idea
nice.
itself.
Mm-hmm.
Mhm. Thank you, Doc.
All right, nice, great. So, I mean, like we said, it's all on the slides. And what's most important for everyone to note is that the systematic review is structured. It's the best source of evidence that we have. So we have to make sure that you follow some steps. You make sure that your search is comprehensive. You make sure that your work you're doing is registered before time in a protocol. And then you try to make everything in your process very transparent. So that's what is really important for um, a systematic review. All right, so let's make progress. Thank you very much. Yeah, so with a systematic review, we try to avoid bias in how we select the topics and how we go about it. That's why, first, for everybody doing a systematic review, you need to register the systematic review on a platform that we are going to look at in the next session called Prospero. So we register our systematic reviews on that platform so that it helps us pre-specify the methods, and it also makes sure that any bias that happens when we're analyzing it, it's more like something that we could not avoid, but we've shown that what we did. And then it's also important now for us to do a comprehensive search to find those articles. So the most idea is that once you fix your inclusion and exclusion criteria, you are able to really follow it out to the letter, and so that it reduces both publication and selection bias once we've done a comprehensive search. Now, a systematic review is not done by one person, so you always have two people doing a review and coming on an agreement. That's just what is most important about a systematic review. So it reduces error, it makes sure that we are all talking in the same language. So that's a systematic review. So that's what we call the bias mechanisms from for making sure that we carry out a systematic review properly. Is there any question on this slide?
Yes, Doc, I want to understand um, why is why student review is necessary to be recognized by two ways.
I can't hear you. Why?
Why is systematic review needs automatic? Yes, needs to be done at least by two people. I don't understand. Someone alone cannot carry out this systematic review. I understand.
Yeah, no, so one person cannot do a systematic review because it's just the way the guidelines have been built, right? If you do
Mm.
something alone, there's a high chance that your own biases are ingrained in that. But if at least two people double check, then we're sure that there is some balance between the opinions and this judgment of selection of studies. It's a lot. And then you have to read articles. At times you have like 1,000 papers to read. Doing it by one person is not very feasible, you see. So you always need two people to divide it, and then they agree.
All right, Doc. Okay.
Hmm. Yep. Nice. So the next slide brings up something which just highlights what we are doing today. Again, that is the journey of a classical systematic review for everyone. Um, Fix questions. You guys have started, write a protocol, build a search strategy. And then once you have a search strategy, you're going to read the papers that the search strategy is going to capture. And then once you read those papers, then you're going to extract them into an Excel sheet, ideally always. And then you're going to now check if there is any bias in the studies you've entered. There's any bias, and once you've done that, Then you are going to discuss the findings from all the studies that you included. So in this data extraction phase, it's where most of the work is done because you are going to select papers, and that's why you see somebody said we searched 5 databases, we got 3,000 papers, and we only included 12. So at the end of your extraction, you have the papers that now you're going to assess for bias, and then you're going to analyze their knowledge to see what they are talking about. And if the data is very homogeneous, then you might want to do a meta-analysis. And when you have all of that, now you're going to write your discussion, which gives you clear conclusions on what you have. So this is what being inside a systematic review looks like. So question, protocol, search strategy, then you screen. Once you finish screening, you capture the articles that you need, and then you correct your data extraction sheet. And that's how a systematic review should be done. So I hope this is clear. Basically, this is on this procedure that we've built this course. So all what you're going to learn in this course is how to do each of these very, very well. That's what you're going to learn during this course, is how to do all of those. So if you trust us and follow all we say, then this would not look as a mystery to you. Yeah. So who here has heard of the word prisma? Hello?
Yes. Doctor, I've heard about it before.
What does it mean? What is it used
So
for?
it's used to check if your systematic review everything actually follows the preset guidelines you're supposed to follow.
Nice. That's good. So what I want to say here is that what this slide is all about is that the Prisma is a reporting framework, right? So where you have to understand in systematic review is that you have a method, right? And then you have a way to report what you are doing. So the Prisma guides basically the reporting of your methods, systematic review. And so in the previous slide, we discussed these methods, that this is what we are going to do. Now, here we are talking mostly now about, okay, how are you going to report whatever you have done as a systematic review? And that's where Prisma comes into place. And it's just conceptual. It's just that you understand that you have a guideline to do a systematic review, which is like Cochrane guidelines, and you have a guideline to report a systematic review, which is like Prisma. So that's just it. Most important thing to take away from here. So thank you again, Lydia, for sharing. Nice. So I'm going to pause here and I'm going to ask a poll based on the questions that we all sent in the forum. Thanks for the people who sent it. There's a poll that is going to appear on your screen. You're going to look at the types of questions on the screen. So we have 4 question types, which is effectiveness studies, prevalence studies, accuracy studies, prognostic factors, and also qualitative synthesis. And the question I'm going to just have you ask all of you is, where do you think your current thought of question is? So you should see a prompt to answer a question on the screen now. And we're going to let it run for 30 seconds. Can you all see a research question poll? Which type is your research question? So one person has answered effectiveness or intervention, prognostic or risk factors. All right. So four people have answered. The other two people are AI agents that are recording our call. So we move. Now, what I want us to know here is that thank you guys for answering. I'm going to share the results. So we have two people who said effectiveness and three who said prognostic factors. So it's fine. Nice. So you guys can see where we all fall. That's where the current type of knowledge is going to be synthesized, which is fine. So now, um, what is most important is that for effectiveness studies, it's really that are you answering a question? Does an intervention work? Sorry for the typos on this slide. Does an intervention work? So it can be that, like we had the example in the previous class, SMSs. Can SMS improve adherence to drug? Okay. If it's somebody that's really doing for something pharmaceutical, can this new brand of paracetamol improve on how people are responding to fever, for instance, or to pain? And the prevalence question is to ask, how common is malaria in Cameroon, for instance? That would have been a systematic review that people would have done years ago when malaria was still new. And then we have a diagnostic accuracy test, which says, okay, for everybody that has been tested for COVID-19 in Cameroon, how accurate are they? Truly, truly, truly positive, you know? So this one is something that you definitely have to do a meta-analysis if you succeed, because you're going to have data on everybody that has done tests, and then you bring that data together, which we call, there's a nice statistical word that we call pooling for it. So you pull the data together and then you analyze to see how accurate the test is. So again, risk factor studies, it's very easy. This one is very straightforward. If I smoke, will I have lung cancer? Um, if I drink, will I have liver failure? Something like that. So those are very simple studies. So you're going to look at all studies that are looking at the effect of a particular exposure to a particular outcome. So how many people smoke? How many studies have looked at people smoking and the rate of cancer? Now, one thing I want us to understand here importantly for systematic reviews is that your question is not on people, right? Your question is on studies. So in the forum, most of you guys were making your questions look like a cross-sectional study because you guys were only talking about people. They are actually taking studies. So here you're going to ask yourself, how many studies have assessed that SMSs work for adherence, for instance? How many studies have spoken about the burden of malaria in Africa, for instance? How many studies have assessed how accurate, right? How accurate COVID-19 test is for African settings. How many studies have assessed how many people develop cancer from smoking? And then qualitative studies, how many studies have described a particular behavior? So how many people, which study is talking about how people are using the internet in Cameroon and how is it affecting their health? So you are just describing and putting the studies together. This is very important because this is how you need to understand so that you're able to discuss your questions and build your questions properly and refine what you already have. So I'm going to pause here and ask if there are any questions on this slide.
Uh, Thank you, Doctor, for explanations. Um, um, Now that you have explained as the difference in different type of systematic review questions, I'm not really sure I have the correct answer. But then now I also I'm just from realizing that um our population years was not supposed to be questions but talking about studies that has already been made published.
Yes.
So now, um, it therefore means that is my question is that if concerning the research questions uh, you had, then you cannot actually see research or studies published on that directly. So how are you going to overcome that? Are you to change your research questions or to understand?
No, you're going to change your question now. That's why we're doing this. So,
Mm,
I mean, the experience last week was to see what you guys would do, how you guys would go about it. And I'm happy that you people did, and now you're seeing why it's important. So
mhm,
now, systematic review is a study of studies. I think that's what we said last class, right? It's a study of studies.
mhm.
So your question in a systematic review is what studies have assessed this? Now, in a systematic review, you're going to hear the effects of SMS on adherence, a systematic review. So when you hear that, the question was, does SMS improve adherence among people living with, let's say, HIV, hypertension, or whatever? Now, that question is asked like that. But because you are doing a systematic review, your method is not to go and talk to patients. Your method is to go and look for studies that have done this already and then assess the effect. So that's the difference with systematic reviews. And the reason why we're doing this now is because you and I are not the first people to think of such questions. People would have thought of it and done it in various angles. So you are saying, okay, I'm interested in this field and this is what I want to study. But before I do it, I need to see what every other person has done so that I can be able to plan my research in the future. Or I'm interested in being a leader in this field, but I need to know what people have done. So I do a systematic review to understand what people have done so that I can make recommendations for healthcare guidelines or whatever. Or I want to do research in this field, so I need to look at what people have done to see what they have not done. And then from there, I can build that, okay, I did a systematic review and I saw that this have been done, but this has not been done. So I want to do this research on that. Have I answered your question, Patrick?
Very well, sir. Thank you.
All right, nice. Any other worries on this slide? All right. Joseph, are you there with us? All right. So now, again, how are you going to select the type of systematic review you're doing? Again, is based on the question you're asking. That's why, again, all right, thank you very much, Joseph. It's based on what type of question are you asking. That's why I send the question, I push you guys to think about the question early on. So the type of review you select is based on the type of question you're asking. Okay. So again, this is going to inform how we are going to use the PICO framework in the next slides. So what questions are you asking? Are you asking for an intervention and its effect? Are you asking for how common is a disease is? Are you asking for a diagnostic accuracy? Are you looking at predictors or risks? Are you looking at quantitative synthesis? So you see that I have effectiveness, we have prevalence, we have diagnostic, we have prognosis, and then we have qualitative. So those are like the common type of systematic reviews that you would see. Now, this list is not exhaustive, but this is a common thing, and it's what is easily applicable. And for me, I would think that it's what, as we are starting as early career researchers, it's those are things that we can easily write down and then assess it. So again, is your systematic review going to be an effectiveness of an intervention? Is it going to be an assessment of the prevalence of a disease? Is it going to be an assessment of a diagnostic test or the accuracy of a diagnostic test? Is it going to be about risk factors? You understanding? Or is it going to be about experiences with a disease, with an intervention, with a surgery, whatever? So that's just how you think about formulating a question. Am I making sense here?
Yeah, exactly.
Yes, doc.
All right. So effectively that's it. Yes. Um nice. Next slide. So when you are building a question now, when you are building a question, you always want to start as broad as possible. So let's say we want to study malaria, right? We are talking about malaria. So this is malaria. But now we want to ask ourselves in which, so the topic is in malaria. Now, in which population do we want to study malaria? So we might say, okay, let's study malaria among pregnant women for gynecologists, for instance. Hmm? So we are studying malaria in pregnant women. Then ask yourself again, what do I really want to study? So you see that this section takes us back to the previous slides where we look at what are the type of research you're doing, right? So that is where you look at it. Is it an intervention? Is it a prevalence? Is it that? And then we go back and then you ask yourself, what am I studying? So do I want to study the prevalence of malaria in pregnant women? Do I want to study the effectiveness of chloroquine in pregnancy? Do I want to study the risk factors of malaria, the novel risk factors of malaria, because malaria is not a new disease? Or do I want to study pregnant women's experiences with malaria during pregnancy? Or women's experiences with malaria during pregnancy. So you see that this is where now your type of SRA comes of, hear me that SR, systematic review comes in. Now, whatever you settle on, so let's say we want to study the prevalence of malaria. It's easy. How do we assess prevalence? The number of people with malaria over the total population, right? So you're going to easily see that as your measurement. Accuracy of, let's say, rapid diagnostic tests for malaria. Then you want to count the number of people who actually test positive versus the people who actually had malaria, you know? So that's how you look at the outcomes. So now you've already had the population, you've already had what intervention or what type of systematic review you're going to do. You already have the outcomes. So the next now is okay, since we are doing a study of studies, what kind of studies am I including? So that's where now you ask yourself, are you going to include only randomized controlled trials? I hope you remember what randomized controlled trials are. Or are we going to include non-randomized controlled trials? Are we going to include all type of studies that we see? You understand? So there again, you go, and all of this, right? You don't make this decision in your head. You have to start reading papers on that topic and seeing what they have done, and they say, oh, but maybe I'll look at studies that have done only a randomized control trial. And then you search and say, oh, there are not many randomized control trial on the topic. So maybe let me put everything. And they say, okay, I'm going to look at both randomized and non-randomized control trial, or I'm going to look at both interventional and non-interventional studies, or I'm going to look at both pop, peer-reviewed literature and gray literature. And then when you have done that now, you can now write your focused question, which is the prevalence of, I'm not going to use prevalence, I'll say the experiences of women during third trimester of pregnancy with malaria in sub-Saharan Africa, a systematic review. Then you have a question like that. So do you guys see how we've moved from just your area of interest, malaria? So we can still take another example. Let's take somebody that's interested in cardiovascular diseases. I'm taking it broad, but we can pick one of them. Let's say hypertension. And again, we say, what in hypertension? Okay, we want to study hypertension in pregnant women. Very interesting. Hypertension in pregnant, but what? Maybe treatment, because hypertension in pregnancy is a very challenging thing. Treatment. Let's see what they've been doing. So what are the treatment that has been done? And what is it? So, but what do we want to measure in that treatment? Now it becomes very tricky. It's pregnancy, no? You have to measure several things. The blood pressure control, the maternal outcomes, the fetal outcomes. You understand? So it's not that I have many things to measure. And they're like, okay, what kind of studies am I going to look at? Should I only look at randomized controlled trials for treatment in pregnancy for hypertension, or randomized controlled trials for everything, or or just every study that has assessed hypertension in pregnancy? And then again, you can now finalize your question. So I'm going to rest here. If you don't understand this slide, I can take it all over, but because this is the most important thing in this lecture, because this is what you need to fix on your question. Because once your question is not fixed, you cannot do a review, right? In our review journey, I think I should be putting this slide in this review slide on every slide. In the review journey, it all starts with the question, right? It all starts with the question. So we cannot do a protocol if we don't fix the question. And you can see that even before to coin the question, you have to read some studies to help you coin the question. All right, guys. Any questions? Any questions? Any questions? Any questions? Any questions?
No, for now, Doctor. I don't have any question.
All right. Frank, any questions from your end? Lydia?
No, doctor, I don't have any question for now.
All right. Patrick? Patrick just spoke. Joseph, any questions from your end?
No, doctor. Okay.
All right. Nice. So let's make progress then. This is where we were. Nice. Now, this is going to be very interesting. And it's going to be a very interactive session. I'm happy that you guys are 4 of you, so each person will take one focus, one framework. Joseph, please read what PICO is.
PICO, population, intervention, comparison, outcome, best for interventions.
What do you make of that?
So I think the PICO format of framing equation is mostly to assess maybe the effectiveness of a particular intervention, maybe a therapy, or maybe a particular sensitization on something we're concerned about.
Very good. Thank you. The keyword there is effectiveness or interventions. You're assessing the effectiveness of an intervention. So there are actually 2 keywords that go side to side. Very good, Joseph. Lydia, can you read what PICO is all about?
Okay. PICO is population, exposure, comparison, and outcome.
Nice. And what's at the bottom? Best for?
It's best for exposures or risk factors.
What do you make of that?
Okay. I understand that you use this particular framework when you want to assess risk factors in your research question.
As simple as that. No, it's self-explanatory. Good. Frank, tell me what PEO is all about. PEO.
Okay. PEO stands for population, exposure / experience, outcome, and it's best for qualitative questions.
Exactly. I mean, do you need to say more about it?
Not really. The qualitative questions.
Good. So they are meant for qualitative questions. So anything they are looking at, how are people going about clearing waste in Cameroon now that his Akam is striking, you know. And who is the last person on this call that haven't spoken? Just Lydia. Who has not spoken? I'm confusing. Frank, have you spoken? No. Yes,
Patrick,
Frank.
Pat,
Patrick. Yeah. Oh, yeah, Patrick. Patrick, go for it. Patrick, what's PCC?
Okay, look, so the PPC stands for population, the first
Mm-hmm.
C for concept, and the last for context. And it's best for this for scoping reviews.
Good.
Now, do I understand? Can I explain that very short?
Yeah.
That I think uh, is good for that is you want to analyze other systematic reviews that have been done. I don't know.
That's a
You know,
very good attempt. Thank you. Thank you for sharing. Okay. So I'm just going to pause here and talk about scoping reviews because maybe we might end up doing it for some of your topics. But the scoping review is a landscaping review. The only difference between a systematic review and a scoping review is that this intervention or exposures are not there. But we're talking about concepts and context. So for instance, we want to understand the landscape of the use of SMS for adherence. That's all. We're not looking at the concept so the concept there is the use of SMS. The context is adherence. Now let's fix the population. Adherence or malaria therapy, HIV therapy, hypertension therapy, whatever, that's the population. So among people living with HIV, people living with hypertension, people living with cancer. You understand? So a scoping review is a landscaping, it's a scoping study. So generally, before systematic reviews, right, they recommend that you do a scoping review. So most of the times it's a feasibility of a systematic review. So the thing that differentiates a scoping review from a systematic review is that you are not mandated in a scoping review to assess for bias in the studies involved because you just want to see what has been done. Okay? Scope, you just take your lenses and say, oh, let me see what it looks like. That's what scoping reviews are. It has the same structure as a systematic review, but just that most scoping reviews will use PCC framework. So if you are thinking of something and you are seeing that PEO, PICO, PICO will not work, try to think of what am I really thinking? Is it a concept and a context, or is it really an intervention and outcome? So the reason why I put this is because these are 4 common frameworks, right, that exist. Mm? And there are many other. If we take you can do a master's thesis on frameworks for systematic reviews. But these are common things that we can apply. And again, the idea is that you should know that there are frameworks that exist for systematic reviews and scoping reviews. And you should pick one that is most applicable for your use case. So if it is not here in your further reading, you can still stumble on something else. Okay? So that's it. Does anybody have a question on this slide?
sir, I've not really understood what a scoping review is.
All right. Let's take a countryman example. You want to build a house, eh? You're a big man now, yeah, a family man, you want to build a house, right?
Yes, doctor.
What do you need to do before you start building a house? What will you want to do?
Yeah, I would like to survey an area, maybe a land at a good site, and get the land and start buying materials for the construction.
Good. So you see that process of surveying before you do anything, it's a scoping review in research. So you are just looking at, okay, what is out there? What are the type of houses? What are the type of building materials? What kind of land is best for the kind of house I want to build? They're just looking at what is out there. That's all. That's what they call a scoping review. Just looking at it. Now, but a systematic review is that, okay, people in Cameroon have built houses. I want to see how the type of houses have built are improving on the lives of people in Cameroon. Different, right? There it's building houses as an intervention. And the outcome is improving their lives or not. Population is people in Cameroon. Or you pick a particular thing. I want to see people that are living in skyscrapers in Cameroon, how their life is better to those of us who are living in cardboard houses, who are living in glass houses, So is it clear now, Joseph?
Yes, Doctor, very clear. Thank you very much.
Yeah. All what you need to pay attention to is that when you're revising your question, ask yourself if using PCC fits better than PICO or any of this other one. That's just what you guys should be thinking. So if nothing has been done in what you're thinking about, then you don't want to do a systematic review. You want to do a scoping review because you want to see everything that has been done anyway. If you see significant work, then you say, okay, are the studies good enough for me to do a systematic review with meta-analysis or only systematic review, a narrative review? Exactly.
Doctor, please, before we go ahead, does it mean that the scoping review is not your research per se? Like, it's not really what you want to work on. It's just maybe you gathering facts and concepts to go in detail to what you really want to do.
Yes, keep that thought. But there is a comma. And it is your research because you are going to inform every other person of what has been done in that field. And then use it to do another new research. Because yes, you can publish a scoping review with your name on it, your full chest.
Okay. I get now.
You get the
Thank you,
point now?
Doctor.
All right,
Yes, Doctor.
good. Nice. So we are going to have examples of questions. And since we are not many in class, I'm going to make it really straightforward. But ideally what we would have done is that we would have gone into separate rooms and then discuss the questions. So Joseph, just stay since you are on my screen now. Our first question is to look at the PICO framework, a sample question for a PICO framework, and it's the one that we used in before. So can you read what is on your screen? Only the text. Forget about the pictures. The pictures is just me trying to make my slides beautiful.
PICO intervention in adults with hypertension in Cameroon. Do SMS reminders versus usual care improve medication adherence?
Good. So what do you see from this question? Joseph, what do you see from this question?
What I see is that it's trying to assess how effective SMS reminders are to the adherence to hypertension medications by the patients in Cameroon.
Good. So what is clear here is that there is a clear population, there is a clear intervention, there is a clear comparator, which is usual care, and there is a clear outcome that we're looking at. So this is just to clarify what PICO is all about. Now, what you need to pay attention is that here you are looking for what? Store these and not P whole. It's very important, right? The unit of measurement here is studies. So that's the difference. Okay. Is there any question with PICO framework? Does anybody doubt how they can criticize somebody else's PICO now and how they can apply it to their own work? I guess silence means everybody has understood. Yes, go for it, Lydia.
And I have a problem with the comparator. Must you always state the comparator? Like sometimes it's not just implied that there is a comparator there.
If you are going to use PICO, you must have a
Yes, okay.
comparator. If you cannot find a comparator,
Okay.
then look for another framework.
Okay.
That's it. So again, the frameworks, there are many of them that exist. PICO is the most common. So if you cannot find a comparator, then know that the PICO is not suited for your question. Is that clear?
Yes, doctor.
All right, Lydia, stay with me, don't go. Now let's talk about pregnancy. Read the question on the screen.
PICO exposure in pregnant women, that's the population. Does malaria exposure versus no exposure, that's a comparator, increase low birth weight as outcome?
Good. So again, here you see that there is a comparator now.
Yes,
And
okay.
here we're looking at exposure. Or what is another name for exposure? It's on the screen.
Okay, risk
It's
factor.
exactly. So it's either risk factor. So we could still change it. What is the in pregnant women? Does smoking versus no smoking affect birth weight?
Yeah.
Or does alcohol versus no alcohol affect birth weight? So I'll not use increase in this case. I'll just put affect because I don't want to be biased, right?
Yes, doctor.
Good. Is this clear for everybody?
Very clear.
Yes, doctor.
All right. Nice. Then next slide. Who has not? Patrick, stay there. Patrick, stay. Don't go. All right, Patrick. Over to you. Read the question on the screen.
Um, PO of qualities of pain among women in rural districts. What experience plus barriers influence antenatal care adherence as the outcome?
Good. So, what do you think about the question? What is it? What has it avoided?
The question has avoided the comparison. So,
Exactly. Good.
yes, here we are
So, yeah,
the, trying to figure out the what are the various experience or what prevents uh the adherence to antenatal care in women living in rural areas. So that's why we have women living in rural areas as our population now.
hmm
Concerning us also its um influence antenatal care and then outcome is adherence.
good. So we see that if PICO or PECO does not work for us, there's PEO, right, that we can use for qualitative reviews. So that's fine. Um, that's it. I'm going to move to the next slide. I don't know who has not spoken. But the last one now is for scoping reviews. Somebody asked a very nice question about scoping reviews. What was it? Was it Joseph? Yeah, Joseph, come back, come back. Joseph, come. I think he was here. Come and read scoping reviews so that we clarify it. Read the question.
PCC scoping in SS
Sub-Saharan Africa, that's what SSA means. Sorry, I could have written it in full.
SSA health system. What digital tools for diabetes care?
Good. Can you?
In SS
Oh, network is not kind on you, Joseph. I can't hear you. I hope it's not only on my end.
No, sir, it's not only you. That's really good.
All right, we lost him apparently, so we'll wait for him to come back. But we can see that here we are looking at a population, which is health systems in sub-Saharan Africa. That's what SSA means. And what digital tools, which is the concept that we're looking into and where it's being implemented, which is primary care context, so GP practices and every other thing. So we see that there's a different way of going about scoping reviews, right? Compared to systematic reviews. Is there any question on this slide?
No, doctor.
No, but
All right, time for you guys to start thinking. So I'm going to speed up a little bit on this ones, but again, what we are looking here is that from your framework, you can build an eligibility criteria for the studies you would include in your systematic review. So from the question alone, so if you look at the adult hypertensive patients for the intervention question, that is clearly our population. So we are including only studies that look at adult hypertensive patients. And the SMS reminder is what we are looking at as an intervention. So all what we are looking at is, okay, studies that looked at in using SMS will be included in our studies, in our review. And then those that are the comparator here is usual care. Now, this is very important. If you have now a study that did not compare SMS to usual care and compared SMS to, let's say, telephone calls, that's a different study, and you are not going to include that study if your comparator is usual care. But another person will say, okay, I'll compare SMS with any other method. So it makes it more broad. So that's how you should be thinking about it. And same thing now with the outcome. So it's adherence. So yeah, when you're searching for studies, adherence is going to be one of the keywords in your search strategy, because we only want to assess studies that talk about adherence in hypertension, in taking medication, in taking SMS and routine care, and then adherence. And then again, now we look at the setting. Do you want to do it in only in a rural setting, in an urban setting, in a primary care hospital, or you want to do it in all three levels of care, primary, secondary, and tertiary hospital? Again, most of the times, do you want to narrow down by design? For me, once you can fix on population, intervention, comparator, and outcome, and the setting was already important for us, it's fine. The designs, you can just keep it open because you want to get all studies. You don't want to limit it so much that your study becomes like as if you are narrowing when you have not seen what is there. So that's what I would say. So this is how you build eligibility criteria. So once you see that everything comes from the question, once you build the question and then you ask yourself, who are the studies I'm going to include? And then start looking at what is the population of interest, what is the intervention, what is the comparator, and so on and so forth. So I've done this only for PICO, but the same applies for all the other frameworks that we're doing on how you're going to say, these are the studies I am going to include in my systematic review. Welcome back, Joseph. Can you get me? Yo. So I'm going to take over this slide because that's the only thing you've missed. But you can always watch the video. So we are you saying something, sir? All right, you can drop a text if sending a voice is challenging. You can drop a chat in the text. All right. So let's make small progress. So Joseph, this is for you. This is for you. I'm taking this slide all over. So I was saying that if you already have your question, and then you want to decide what studies you're going to include in your systematic review, you simply need to match the variance population to everything here. So what is the population of interest? What is the intervention? What is the comparator? And the outcome and the settings. These two are good when there's so many studies already done. And then you include those, but if there are not many, then you want to stick to these very open ones. All right. I think he's lost us again, so we'll continue. Nice. So, I mean, we can do this in 5 minutes, or you guys should tell me if you guys want to do this to work back on your questions in the forum. So tell me, because the next slide is just practical. So this is what I had planned that we would do. So everybody had to sit down again and write their questions in 10 minutes. So I can set a timer, and then once we are done, you guys come back and share your questions, and then we're going to critique it in the next session. But what is most important that you guys should pay attention to is what you're going to choose to write your framework. And so do we want to do this in the WhatsApp forum after the call, after the meeting, or do we want to do it now? I mean, we are just 3 of us on the call, Lydia and Patrick.
I think we can do it now, but
Yeah, I think we
I
can
didn't
do
get
it right now, so that we can correct ourselves and move on. That's what I think.
All right. Okay, guys. So you guys feel free to, I'm going to set a timer, but I'm going to give you guys how much time do you guys think you need?
Don't you're the one feeling doing
Yeah,
like
you
that.
guys are few now. So I'm going to give you guys so this is 8:30 your time. So I'm going to give you guys 10 minutes. Is that okay? But if you're done before that, just unmute and we start discussing.
All right. So, what is really expected us to do is to choose the framework that match our question,
Question. Yeah.
and then
And then refine your
uh,
question.
mhm, okay, and then from our question, define say eligibility college. That's
Mm-hmm. Mm-hmm.
okay. Look, what are those small images down? What are they for?
No, these are an example. This ones is for the topics that we discussed already now.
Mm-hmm.
Yeah, so but this does not
Okay.
concern you. It's just to bring your idea back so that these are type of questions that you should pay attention to.
All right. Then. Okay. See you.
Mhm. All right, so 10 minutes starts now. All right, guys, 10 minutes is up. Hello, 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 hello. Hello, 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 hello. Can you get
Hi,
me,
doctor.
Lydia? Yeah.
Yes, I can.
Yeah. Patrick, are you back? Yeah, I see that many people who have joined back. Yes, so who wants to go first? So for the guys who lost, who fell due to network, we had to just give 10 minutes for everybody to think of their question. Yeah. So we are still the two of us, Patrick and Lydia. So Patrick, you have the floor. Your mic is unmuted, so you can present your question.
Okay, thank you for giving me the floor. Initially, first of all, my question is very long. I don't even know how I'm going to use that, but it's actually very long. But start, before I start, I want to say that I choose this question in particular because that was something that really mattered to me during my previous internship or some this
Hmm.
one. So I wanted to actually find out if research has been done concerning the piece. So initially, my question was in patient with acute myocardial infarction on full dose anticoagulation who develop an acute response for was continuing full dose anticoagulation compared to the interruption of reducing the dose reduces the risk of thrombotic recurrence. So that was initially my research question, and I decided
Hmm.
to a PICO framework in which my population was defined as the adult patients with acute myocardial infarction on full dose anticoagulation developing an ischemic stroke. The intervention here was continuing with full dose anticoagulation. The comparison here was reducing or stopping with anticoagulation, and the outcome here was the recurrence of the thromboembolic events,
Hmm.
either being myocardial infarction or systemic embolism, or even the transformation of the skin stroke into a hemorrhagic stroke. So I reformulated or refined my question as follows. So, does continuing full dose anticoagulation treatment versus reducing and stopping the anticoagulation treatment reduces the recurrence of future thromboembolic events in adult patients with acute myocardial infarction developing ischemic stroke. So concerning the eligibility rules, I think my population is defined, the intervention is defined, comparator is defined, my outcome also. Now the context here, I think the context here should be patients with acute myocardial infection that develop ischemic stroke. And concerning the study design, I think, as you said, it's better to not to specify a specific study design for the research to be actually broad. And the limits now, I don't know, my limits will be fine. And, okay, so
Um,
that's that. But,
I missed some things. So we're using PICO
mhm,
now.
yeah,
What is your population again?
adult patients with acute myocardial infarction on full
So
dose anticoagulants.
on full dose anticoagulation,
Developing an ischemic stroke.
what's the intervention?
Continuing the full dose anticoagulation.
What's the intervention?
Continuing the full dose treatment on anticoagulation.
So anticoagulation.
Mm-hmm.
What's the comparator?
Reducing or stopping the treatment. Reducing the dose or stopping the treatment.
Mm, mm, I have a problem with that.
Mm-hmm.
How are you going to find studies that assess that?
That is not for the problem, but I don't know.
So, I'm just going to
Even
give you some points of some thoughts here, right?
mm-hmm.
The question is not written on stone, so you are going to go back and reflect on it. So when you talk about the
Mm-hmm.
population, you have to just be clear, right? Population of people who have acute myocardial infarction, period.
Mm-hmm.
Intervention, those on anticoagulant therapy.
Mm-hmm.
Okay. Now, comparator, those taking any other therapy for AMI or those not on anticoagulant therapy. That is a more balanced comparator.
This
And then what is
people
the outcome?
and comparator.
The comparator is no anticoagulant therapy because not everyone always get anticoagulant therapy after an AMI, from my understanding of AMI management. But
Mm-hmm.
you have to read on that. It's not my piece of cake. Now,
Mm-hmm.
the next that I wanted to ask is, what is your outcome?
The outcome is the the reduction in the recurrence of another thromboembolic event.
Okay, so the outcome is embolism. So I'm going to make your life simple here, right?
Yeah.
From what you have said, our population is people with MI, with a history of embolism. That's it. Hmm? Your intervention
People,
is huh? Say that long
people.
sentence again. People with AMI with what? Say it.
Okay, let me say something. Here was here is these are the patients. The population was actually patients that developed here the myocardial infarction, but now that developed an ischemic stroke still on that still on the anticoagulation treatment for the myocardial infarction. So that was actually my population. And now, as you said, to make life easier and increase the risk of timely research or studies that align with that, I think I will go like you are saying. So yes, I'm listening on that.
Don't take anything I say as gospel true, though. One thing that I've learned from research is that, I mean, I'm very humble. I don't own ideas. So what I'm just saying, right, is that
Yeah.
you're going to read at least 10 papers on myocardial infarction broadly, and then
Mm-hmm.
understand what is the problem you want to look at in a systematic review. Or you can change it completely if you're interested in, like you see where we started, cardiovascular medicine,
Mm-hmm.
right? Now you have gone so specific, so niche, as if you've done a systematic review already. I know that that is where the problem is. It's true,
Mm-hmm.
in clinical practice, you would see some things happen, but you need to understand what other people have done. So you need to read studies. That's what a systematic review is all about, right? So
All
what I need you to do is simply to go back. If you say population of people with myocardial infarction, stand there first. You will have people who have stroke, embolism, whatever, many other things. Now, if the studies are too many, then you narrow it down. Population of people with myocardial infarction with a stroke, and then you look at it.
Oh,
So that's how you go.
sorry.
Start broad. Everything starts broad. You remember the funnel now? Everything starts broad. Hmm?
Mm-hmm.
Yeah. So that's what I want you to understand from what I'm saying. Everything starts broad. But I mean, I hope that this idea is given. For me, I would say population of people with myocardial infarction with or without embolism, I don't care. On who have taken anticoagulation therapy versus those who haven't taken anticoagulation therapy, and the outcome is how many of them developed embolism or a cardiovascular event, or keep it very broadly, is cardiovascular event. And then you see
So
now, if you see
come again with the outcome. I couldn't get.
a cardiovascular event, period. It can be a stroke, it can be another heart attack, it can be embolus, it can be anything.
Okay.
Yeah. So you keep it open. So there you have more things to look for in your outcome and in your criteria.
Mm-hmm.
So yeah. So but go now, read five to 10 articles on this topic and see
Mm-hmm.
how people are framing things. And then you'll be able to do that. Next, any question?
Um, now no. Okay. I'll try to look for the articles and read on them
All
to
right.
refine
I'm
it.
saying, yeah, I'm dropping something in the chat that I've just written for you. You can copy it to your reading.
Okay, but thank you.
Good. Lydia, over to you.
Okay, thank you, doctor.
Mm-hmm.
My own research will be using the PICO framework, and
Mm-hmm.
my question is: among adults attending primary care in sub-Saharan Africa, does the patient health questionnaire 9 depression screening tool increase the diagnosis of depression compared to routine care?
So primary care adults in sub-Saharan Africa.
Yes,
And what's your intervention? The
yes.
depression questionnaire.
The
Eh?
yes, the patient health questionnaire screening tool. Yes, doctor.
PHQSS, no? That one.
The intervention here is I'm using a
Yeah,
PHQ-9 depression
PHQ9.
screening.
Okay, good. What is the comparator?
Routine care,
So
just normal consultation,
no PHQ9.
no screening.
And what is your outcome?
Yes, an increase in the diagnosis of depression,
Increase.
increased detection of
Why do you choose to say increase?
higher detection. Yes, something like that. That impact on the diagnosis of depression, and then I was confused. I don't know if it's better to say an increase in the diagnosis or higher impact, or because I know in routine
Lydia,
care patients are
I
still
lost you.
diagnosed
I lost you.
with
Can you come back to your outcome? Can you tell me about your outcome? Network is
actually
breaking. I can't hear you. Jeez.
detected that this patient is depressed, but they don't really use the tool, any screening tool. Doctor, my outcome was an increase in the diagnosis of depression, like have a higher impact on diagnosis. I mean, compared to not using the tool at all. Hello.
Uh, Can you get me?
Yes, Doctor, I can.
What I meant with your outcome is that what made you want to assess increase? I mean, for me, right, in a systematic review, you have to, in order to show that
Yes,
you are not biased, you have to be indifferent of the direction of change, right? It can be increase as well as it can be decrease. You get it can be increased as well as it can be decreased. So you have to be
yes,
able
Doctor.
to maintain that openness in the question you're coining. So keep it as impact of that intervention among people who have the disease in
Okay.
question, right? So that's what I would
Yes,
advise.
Doctor.
My own question for you is why the topic, and that's where the assignment for next week goes into. You need to really go and read and see that it's a problem that is important. PHQ9, how impactful is it in mental health care and all of that? You have to be able to understand because it's based on that is going to help, it's going to make your research publishable, you know? So think very
Okay.
much on why the topic. Think
Thank you
very
very
well on
much,
why the
Doctor.
topic. So I've dropped something in the chat for you as well.
Okay, thank you, sir.
Mhm. And I'm going to. All right, guys. So I'm going to go back to the slides and we're going to make progress. Are we happy with the exchange we have?
Yeah, Dom. Very
Yes,
happy. Thank
All right, good. So now I'm going to skip this. This was another fun challenge, but this brings me to the next assignment, which is you working on the first part of your assignment. Apologies, eh? I thought I had updated this slide. I need you guys to cite at least 10 references, not two to three, at least 10 references. So what you need to do in your assignment is now that we've discussed your questions now, you see what the other people who are not present have missed. They've not had this discussion with their questions on really how to understand it. So you're going to go back with your mentor and brainstorm. Now you guys are brainstorming on it, but you are going to read at least 10 papers. At least 10 papers. I'm going to send this in the email. I'm going to correct it. At least 10 papers, but it's already in the to-do list because I shared that already. At least 10 papers in the lecture plan. This assignment is already there. 10 papers on the topic that you are interested on. And then you're going to revise your question and objective. Okay. So again, this should be based on a particular framework, like we've discussed already. And you should clearly state one, two, three, four. Like I said, these ones are nice to have. You must not necessarily have them. You start limiting when you have so many studies and you want to reduce the number of studies you have included. So if you guys are able to do this before the 24th, then I'll be happy to say that you have made a step towards writing your proposal. So you will have a background, you have your review and your eligibility criteria, which gives us a first half of your proposal. Is this clear?
Doctor, please, I have a question. Because initially we're supposed to write a one-page topic
Topic summary.
summary.
Yes.
Yeah.
Mhm.
So this
This is this is
is
this
going
is this is
to be done before.
so the topic summary, it's an expansion. This is an expansion of a topic summary. You understanding?
Okay. So
Yeah.
uh, we're going to write the topic summary and submit, and then we're going to also do this
Yes.
as well.
Yes. this topic summary is going to help us know if you are going in the right direction or not, so that we direct you before this one comes in.
All right.
Mhm.
Because I know that for some of us, we have already discussed with you how our research questions should, what our research questions should look like. So I don't know about the others now.
It's okay. Don't bother about others. Others will sort themselves. I mean, I know you're the cohort representative, so you just need to make sure that they discuss their questions ahead of time with their mentors and send them to on the forum. So that's what we're going to do for those who are not present. And
Okay.
yeah. Mhm. But this is going to be
Thank
clear on the email.
you, Doc.
Thanks for interjection. So we're going to do that. Any other questions?
Okay, Doc, I have a question. What do you expect to be written on the background when I see one or two paragraphs? What are you expecting there?
All right. So in your readings, you have the Prisma framework that I said everybody has to have a look at now. So now that you've asked that question, I'm going to pull up the Prisma framework and show you what it says that you should report in the background. So that's going to give you an idea. I'm not a person saying it. I am not big enough to recommend what they do in research. You understand? So let me share my screen. Can you see my screen?
Yes, Doc.
Good. So the background is the introduction, right? Again, in your course directory, you have this document embedded in the link. You can click it and view it from your end. But this is what your introduction should look at. A clear rationale which describes the current state of knowledge and its uncertainties, the importance of your review, if other reviews have been done and why yours is different, if the review examines intervention effectiveness or how things might work, and then if there are any complexity, blah, blah, blah. So all of this is well written. I'm not inventing the wheel, okay? And then again, your objectives clearly stated. So this should not take you less than 2 paragraphs, at least 3 to 4, but ideally 3 paragraphs. Have you understood? So this is what we are following. This is how we are writing and going. And this has everything documented on what is expected. So that is the introduction and your objectives. And then you see that we start with eligibility criteria now. Again, all of that, all what I'm telling you is in this document. I'm just making it very simple for you to understand.
All
And
right,
then in
Doc.
the next sessions, we'll start talking now about information sources, which is searching databases and search strategy. But you see that already we would have covered your title. We'll write abstract in the end, so we'll skip it for now. But we'll have covered your title, right? And then
Mhm.
we have discussed how to build your question and write that. So this is it. This is where we are now.
All
Does
right,
it
Doc.
make sense? Mhm. So that's why I say every email I send to you guys is important. Mhm.
Yes, Doc. Yeah.
All right. Nice. Good. Any other worries? Let me go back to my presentation. I want to acknowledge the presence of Dr. Marius here, one of our mentors. Dr. Marius, good evening.
Good evening to everyone. Uh, I really missed a lot. I feel like if they could win back the arms of the clock, I would be very happy. But let me continue enjoying
Eh,
from here.
all right, sir. Nice to have you on board.
Thank
Yeah,
you. Interesting, very
yeah,
interesting
yeah.
lecture.
All right, good. So, guys, so we are clear about the assignment. So, Lydia, your course rep. So, communicate the assignment in your own language to your cohort. You can write it in the WhatsApp group, and then myself, I'm going to send an email tomorrow morning with everything assignments and everything, the video and all the things that we have here. So that's it. So I want you
Okay.
guys to Cochrane Handbook is free online. I would embed that on your study material so you can also read whenever you're free. I mean, it's just to read the planning question chapters. And then the Prisma guideline is what I just showed you guys, or the Prisma reporting guideline, what I just showed you guys. So these are the things that you need to look at, but I'll just focus on this Prisma because it states exactly what you should write, like I've just shown you guys. So that's what you will need to look at when you're writing your stuff. Okay. This one is short and direct. This one is long. You have time if you want to flex, right? So that's it. Any question? I mean, there's no question on this slide now. So yeah. Yeah. So again, um, this is an old slide from last class, but I'm going to adjust it because your assignments will need you to take more time. Tuesday is too short. So I'm going to see how to adjust it. But the deadline is going to be the 24th. I don't know when the 24th is, but from today to the 24th is enough time for you guys to get done with those assignments. So, but I'm going to communicate that via email. And then, I mean, these are the rules, right? Lydia, who is course rep, please keep us informed with those who say that they are not going to come. And when anybody tells you they cannot make it to class, they should clearly tell you how they are going to catch up. Because, I mean, I'm not going to give this lesson again. You guys who attended, you've seen how we've been able to work on your equation. That's what they would have benefited from. But yeah, so that's it. That should be very clear with what they're doing. But last but not the least, you guys are part of SRA now. When you are done with your course, you'll be invited to become part of us. So we do a lot of services. And I want you guys to follow us on all social media handles, LinkedIn, Twitter, or X, Facebook, Instagram. Follow us. You already have our website link. This is it down here. SRA.shine limited. So you can also check our pages for our services. If somebody asks you about what SRA is all about, you can freely share that page with them. And then, I mean, if you have your phone with you, you can scan this QR code to take you directly to our pages. But yeah, so we do services in data collection. And what we simply do with data collection is that we have teams collect data for people and then we give it back to them. But if they cannot do much with the data, we can still help them. So we also have, like, if somebody has done a thesis and they cannot write it into a publication, we provide that support for them. If you have a team and you need them to learn about research, data analysis, we can also do that for your team. And if you want to apply for scholarships, if you want to apply for grants, we can help you. Personally, with my experience, I have lived on scholarships and grants all my life. So I'm very lucky. So I can share a thing or two. I can say that I have mastered the art of getting people to pay for me to go to school. So that's one skill that I can say that I can put on my CV with my full chest. But the other ones, yeah. And then yeah, we can analyze your data. If you're finishing your work, if you have somebody, yeah. So what is the need for you? Why am I showing you guys these things? Because you guys have friends and you guys have to be also our ambassadors. I mean, this course that I'm doing, maybe you guys would have paid like 200,000 to attend it, but it's free. And that's just what we are doing. We just want to be able to do research together and we want to work with people who are happy. So for every person that comes to SRA with a service that you see here highlighted, if the person came through Patrick will have 10% of the fee that that person is going to pay to SRA to get the job done. Now, if Patrick has finished his course in SRA and we can trust him to carry out, let's say, data analysis, Patrick is going to get 10% of the referral fee and also probably 40% of the analysis fee. So that's what is in it for you guys. So spread the word. Just for referral, you get 10% of it. And then if and when you join the community and we are certain of your quality, you can also get paid for doing one of these services. For now, I see most of you guys doing data analysis. By the time you are done with your manuscripts, you may be able to understand how to write journals, fix manuscript. I'm going to show you how to learn by doing. I mean, you can readily already collect data, participate in collecting data. So that is very easy for me to introduce you to. Okay, so that's just it. But this is me doing marketing for SRA, and I hope that you also share the word with other people. But yeah, any questions on the slide?
Dr. One, I need to write concerning all the different services SRA proposes. All the services are being done in English. If somebody requires a service by in French, how is it going to be done?
If somebody requires a service, I mean, we can analyze data in any language. That's fine. French journals are not that many. I'm not sure I can be able to help somebody publish in a French journal because I've never published in one. That's just it. But we can always play with our strengths on things like data collection, irrespective of the language, but data analysis, irrespective of the language. Scholarship and grants, most of them are standard. We can work in English and then get a translator for you if you need that. But I mean, if there is English, if there's French speaking, somebody needing French speaking service. I mean, I'm bilingual, so we can offer the service in French. It's not like the course where we are giving it only in English. The course, I mean, I did not learn these things in French, so it will take some time to build a course in French. Maybe when we are done with you, we can work together to build the French version of this course. You understand? Yeah, so that's how we can do it. We can work together to build the French version of this course. And as well, when you finish, if you want to build a French digital twin of everything, we can do it together. It depends on your capacity and your interest. So this is me just telling you that we are very open to collaborating, to building strengths and working together.
All right, all right.
Can I choose something?
Yes, Marius, go for it.
So apart from what you just mentioned about translating platforms and lectures, I think we also have a good number of other mentors who are also very versed in the French language.
In
And some
French,
have,
yes.
Dr. Bruna, I think Dr. Bruna has a very big school in
Yeah, it's a
French
big scholar in
research.
French. Yeah.
So there's a big number. If somebody needs a service in French, I don't think that will be a limitation. But now I'm teaching the courses in French. That's a different thing. Having a service done in French is another thing.
Yeah.
But if it's having a service, I think we can render a service in French. I don't think it should be a limitation. Almost all what you mentioned can be rendered in French. And now teaching the course will be totally
French, yes,
different
it's
thing.
Yeah. Thanks, Marius. Thanks. So the answer to your question is yes, Patrick. All right, guys. With that said, I think we move to my last slide. Key takeaways for today is that we've understood how to develop question clarity and also how to build your protocol for your discipline. We have looked at how this question is going to drive everything that we do in the next sessions. And now we want you to build the first part of your proposal in your assignments. So I think this is summary of what we have done, right? And thank you all for your kind attention. And yes, if you have any questions, send them. You can ask them now or send them later. You receive the recording, the slides, and all the links of the resources that you need. by dawn because it takes me the whole night to prepare them. Download the video from Zoom and then put it on a YouTube channel that is hidden so that everybody can see it. So I'll do that, and tomorrow morning you guys will get everything. So any questions?
No, there is no question for me. Everything
All
has
right.
been well done.
All right. Thanks, guys. Okay. Without which, we will take our family selfie and then we'll say goodbye, everyone. So turn on your cameras. We are just three of us, Lydia, Patrick, and Dr. Marius now. The other people are having their note takers in the platform. It's okay. All right. Good, good. All right. We are taking a selfie in 3, 2. Oh, your phone is turning upside down, sir. We're taking a selfie in 3, 2. Cheese. Smile, guys. Another one. All right, guys. Thank you all for joining and see you next week. Stay healthy, be hardworking, and yeah, let's do this. You've seen the journey already and you've seen how we're building on it. So whatever you have learned today will help us in the next session. So make sure you apply it immediately. So, all right, guys. Have a wonderful one.
You too,
Thank you.
doctor.
Thank you, Doc.